what I wanted to talk to you today about was treating and billing for PARO. And this is just things from my experience as a healthcare provider. I see patients, and I've been using PARO for some time now. And it was particularly helpful during COVID for treatment of isolation and depression and anxiety, those sorts of things. What I'm finding now is that it's equally impressive in the results I'm seeing with post-COVID, as many of the folks who had severe cases of COVID as they are aging. The COVID is creating a syndrome called long COVID syndrome, but they're having symptoms that are very similar to the behavioral and psychological symptoms that we see with dementia. And so I'm still finding that the PARO is very useful, especially during my exams with patients. Some are very anxious, and so the PARO is adjunct to what I'm doing for them medically, that also can help them to keep calm during the process. So, that's my primary experience with PARO, and I've been working with the device for some years now. So to me, there are kind of 4 buckets or boxes of codes, if you will, that apply. And the ones that I use most frequently are extra time codes, because I can do a medical visit and then work on the psychological aspects of the patient's condition with the extra time codes. And so far, I've been successful in billing those. They do have to be well documented in the note that I submit for billing, but so far we've been successful in billing those extra time codes, and I'll share those with you as we go forward today. And then the other piece that I've also been successful with, and these are with my psychiatric patients, is with biofeedback therapy. And it's really helpful, especially for those patients or residents that I see that are troubled with anxiety. And also, I've been using it with some of my post-stroke patients, those who've had cerebrovascular events, in helping them not only with managing some of the thought processes post their stroke, but also to help them with fine motor skills. I've made some clothing pieces and jewelry pieces for my PARO, so it's helpful to them to be able to put a necklace or a cape on the PARO and use those fine motor skills to do that. We find that if that is repeated enough, that the patient can then begin to do those things for themselves. And sometimes they lose those skills and that dexterity if they're having like transischemic attacks or strokes, small strokes, so that we find that's helpful as well. So that piece of therapy is also applicable for utilization with the PARO. So what I did in each of these slides is to put in the links where we can look at the actual codes. And this particular one is about service or HCPCS codes, as they're called. In medical practices, we use what are called E&M codes. These are evaluation and management codes. So this is like you see the doctor. This would be an evaluation and management. If you go and see them for a cold or an upper respiratory infection, that would be an E&M office code. In my case, we do house calls, and I go out to see my patients in their homes or in assisted living or senior care environments. And so that's where I'm seeing them. And so this prolonged code allows me to see them for the medical condition. Let's say they have high blood pressure, hypertension. I'm seeing them for that, but then they also have anxiety or depression. So I may take PARO and we'll do a session at the end of my visit. So this extended code allows me to build that particular code. So there are different types of codes for this. These are all explained here, but there's a 99358, 99359 that don't necessarily include a face-to-face visit. So in my case, we do, and because I do want to use the PARO, but these are all listed and they're done in increments of 15 minutes each. So let's say that I completed a medical visit with a patient, but I wanted to spend 15 additional minutes with using PARO to address anxiety or depression or to work on fine motor skills with that person. Then I could do that and build these additional codes to Medicare or to their Medicare Advantage or private insurance plan to help defray that cost, but they can be billed. So this particular page that I've linked to here for you gives you the opportunity to read about these codes, and it tells you the rules around reporting them, which is important because only certain codes can be combined with others. And this goes through different fee schedules. These came in 2021 and are still valid codes, but these are the additional time codes that can be billed. So this website is embedded in the PowerPoint. And so what this does is to give you kind of the coding intelligence here and how to do that. I can send you the actual tables, but I find it's very helpful in reviewing this. These are the codes that are listed in your physician fee schedule. They redo these every couple of years. This one from 2021 is still in force right now for these particular codes, but this lists all the CPT codes and gives you the values, but it also gives you the rules around which code you can use it with. So for office services, for instance, it gives you what the code is for 15 minutes additional time. And it's done in increments of 15 minutes. So I can add that to my visit code for the medical visit. This is another one that's listed here. I think this website is incredibly helpful in terms of providers and those that are using PARO. There's also additional cognitive assessment planning codes. These are helpful, and PARO, can be a part of this as well. Just in terms of interaction and following direction when you're assessing someone's ability to interact within the environment. These are the home and residence codes. So if I'm going into a nursing facility or assisted living, these are ones that I can utilize as well. Any questions on the prolonged codes?
So there are differences, but they can be used for the both institutional care and also the home.
Correct. This visits or at home. So if you have a medical provider who has seen patients in the office, they can use PARO to do these extended visits. I happen to do them in the person's facility or home. And so I'm taking PARO with me to the visit. So it's just that you could still do that and address. You just want to make sure that you're documenting what you're doing and also that it's medically warranted. So if they have a diagnosis of behaviors related to their dementia, anxiety, or depression, then these would be appropriate codes to do that. Does that make sense? That way you would be able to bill for that.
So as for these codes, so they can be accepted, both these codes can be accepted by the Medicare, Medicaid, and the private medical insurance companies?
That is correct, yes. So let's see here.
As for the prolonged codings, are they only for the prescribers, like nurse practitioners, medical doctors?
Right. These would be physicians or nurse practitioners could do that. Yes, they would be able to utilize that. So if we look at the next one, which are the biofeedback services, these are, again, it's just a link that we can share. So the other thing that is very helpful is with this is as far as billing or the biofeedback codes. This one is a very good, I think, website for that, where you can talk about those. Let's see if we can get this to go away here. This billing and behavior coding and assessment. So this one gives you all the coding guidelines for that. There's a number of coding sets that you can use here. And especially for those who work in psychiatry, these are codes in this third paragraph here for my cursor. It said for patients who require psychiatric services or adaptive behavior services. These are some other optimal codes to use with PARO. And it gives you some very stringent guidelines around the documentation that must be maintained for in order to bill for these, because those, we do see some denials on these. So you have to be ready with your documentation. And it includes all these things that would normally be documented by the psychiatrist. But all of these CPT codes can be utilized. And so I integrate in my psychiatric practice, I integrate PARO frequently into those services. But this gives you a description in this particular article with the entire group of codes that you can potentially utilize. And so you have health behavior interventions, all of these. These would be particularly good too for individuals who work with autism and kids on the autism spectrum, because you can do the additional time codes like this one. And you can build those in 15-minute increments. So it gives you all of these codes within that article to utilize for that. So for instance, I might see a patient for behavioral assessment and then do a session with PARO as a part of that treatment plan to work on anxiety, or in the case of the autistic child, I might work with that person on socially acceptable behaviors and how to talk to other people, how to respond to others, not hitting them, not doing socially unacceptable things. And so the PARO allows them to practice those skills without, hurting another human. But, if they misbehave with the PARO, we can talk about what happened and what a correct behavior might look like. The PARO, when you pet it and you're nice to it, but when you hit it, then he's, hurts him. So we can talk about some of the feelings that are the feelings we should have toward other individuals and towards pets and things. That would be an example of the type of behavioral or biofeedback therapy we might do in this particular instance. With my older adults, we do biofeedback just to allow them time to express feelings, because many of them felt very isolated during COVID. They're going through a lot of grief and loss. Some of them lost family members. Some have lost their ability to speak or interact with others. And very often they'll talk to PARO when they might not talk to another human. They may speak to the PARO. So we find it very helpful with those who have cognitive communication deficits, those sorts of individuals. The PARO is very helpful in those treatment plans as well. Any questions on those?
In the past record, the treatment of biofeedback therapy with PARO could be done by a physical therapist like PT,
Yes.
OT, SE, nurses, and also licensed clinical social workers. But in the web page, there was a description of a clinical psychologist.
Yes.
As for the biofeedback therapy, if the clinical psychologist use PARO for the treatment, as the Medicare or private medical insurance accept reimbursement now?
Yes, they can. Clinical psychologists can bill. They have to go through the vetting process to be able to bill. So they have to be credentialed with Medicare, and they have to be credentialed with any of the private insurances in order to do that. But yes, anyone who is licensed, is a licensed clinical psychologist, or even, in some cases, a social worker can bill. They usually have to bill through another sort of practice, but many of them now are billing on their own. And as long as they have that credentialing with Medicare, Medicaid services, and or their credential with private insurance or the Medicare Advantage plans, then they can bill. And these codes apply to almost any kind of, as long as they're a licensed medical provider, they could bill with this. So like for occupational therapy, there are some codes that I've included there. We don't have to look at all these because I think they're very similar to the ones that you sent, Takanori, on your email today. But OT and PT can utilize those. These are specific psychophysiological therapy codes that can be utilized for PARO as well. These are new ones that are relatively new ones that have.
So in this case, who prescribe the biofeedback therapy?
Well, I mean, it can be a therapist who's seeing the patient under insurance. Primary care provider will do a referral to a specialty. So for instance, if I didn't do this myself, one of my license includes a specialty in psychiatry. So it's a good fit for me. But let's say I didn't do that. I only did family practice and I wanted to refer to someone. So I felt as though they needed a clinical psychologist to see them for cognition. Right now, speech therapists, occupational therapist, clinical psychologist can see the patient. Even masters of social work can see them. And if they're set up to bill Medicare, then they could use these codes. But it would, in some cases, necessitate a referral from me to do that.
So, for example, if the clinical psychologist own PARO, and if he or she want to use PARO for biofeedback therapy for his or her patients, can they prescribe PARO or for
Yes.
biofeedback therapy
Uh-huh.
and
Yeah.
conduct the
They sure can.
and get paid by themselves
They can. Mm-hmm.
with these CPT codes?
Yes. Mm-hmm.
So that will be a good motivation for the therapist to own or to own their own PARO or to provide this therapy.
That's right. They could make the recommendation for, I'll give you an example, Takanori. It's like if a physical therapist contacts me about one of my patients and says, this person needs to have a rolling walker or a wheelchair, then I would write the order for that, for them to evaluate for that. If the therapist said, I think it would be beneficial for the patient to have PARO 20 minutes 3 times a week or whatever that looks like, then technically if the person could get a PARO under, as a medical device, and we could prescribe it that way, then
the person is the therapist or patient?
For this for the therapist, and then I could write the order for PARO 3 times a week for 20 minutes 3 times a week. So we could have them if they evaluate it. So I could write for PARO to begin with if I wanted them to have that and have the treatment, or if a therapist is seeing them and I'm the primary care provider, then they can make a recommendation to me and say, we'd like to get an order for this. If PARO is furnished as a durable medical device or durable medical equipment, it would be like a wheelchair, walker, any of those things. I would write the justification for that and send it to the company that had the device. So that would be usually a durable medical equipment company. And then that company would supply the PARO or the wheelchair or the walker to the patient, and they could use it the prescribed number of times weekly. That would be an example of how it might work. If the facility owns one, I could prescribe PARO treatments, and that's what I've done in the past, where a facility actually owns a PARO, say 20 minutes 3 times a week, or therapy, robotic pet therapy 3 times a week for 20 minutes. That's just an example of the order I might write, and then they would put it on their administration record or medication administration record. So they would take the PARO or interact with the PARO in that resident 3 times a week for 20 minutes as a treatment modality.
At this point, PARO is not registered as a durable medical equipment. So, of course, in the future, we'd like to do that. At this point, how we can expand the usage of PARO? For example, if we promote PARO to the therapist, and if a therapist own PARO, can they provide
treatment with PARO 3 times a week? Yes, they could. Mm-hmm.
Sorry, I can't hear you.
They could. You could do that if an occupational therapist owns a PARO. You could say biofeedback therapy 3 times weekly with OT, because they're allowed to do cognitive therapy now and get paid for doing that. And so the PARO could be utilized that way, or you could expand the
in that case, like medical doctor or like nurse practitioners, such prescribers have to prescribe the biofeedback therapy beforehand, or if I wonder if OT or PT or such therapists can decide or prescribe the 3 times a week of usage of PARO.
Yes, they could use it as part of their therapy, especially now that, especially with speech therapy or occupational therapy, they can do cognitive behavioral therapy now with patients and get paid for it. So it would make sense to open the use of PARO up to them, because they can work with cognition. And I think the other way to expand would be to include or to have nursing homes have more of them, so that you could prescribe and they could furnish the PARO to residents for whom it was ordered. That's another possibility, but with that approach, I think, is educating providers also that it's available for their patients, and saying, you can prescribe this for the patients.
I have another question. So as for these codes, like 90875 and 90866, do they have higher payments than ordinary therapy? In case of biofeedback therapy,
It can pay,
so
it
my
pays,
question is,
yeah, it'll pay around $100 to $140 for a session.
so that's higher than without PARO.
Yes, yeah. You could pay, because a lot of people don't have the means of doing biofeedback therapy. And so this one, you could incorporate it with the psychotherapy and bill like a 90875 or an 876. And maybe you bill it's going to pay more than other codes that you might be able to use for biofeedback therapy. And so many therapists who are occupational therapists, psychologists, those types of individuals could bill more and could bill an additional time code as well to this if they used PARO in their assessment or treatment of the patient.
Using PARO is beneficial for the therapist.
Yes, correct. It is for me in my practice is in psychiatry, and it would be for those individuals also. Yes.
Thank you very much. They're very interesting.
It is. And some of the codes have changed because there's more of a focus on mental health now than previous. And so, I think it's definitely a benefit to utilize biofeedback as a part of therapeutic assessment and treatment.
What is the successful rate getting reimbursed by the Medicare or private insurance?
I've had very few denials, but I am very thorough in my documentation because you do get payment reviews. And, once they view your documentation for a few times, now mine is, I would say 90 to 100% because they've reviewed initially and they see that I'm going to document correctly and carefully and I follow the rules. And so my reimbursement has gone up a lot. Initially there were some that were denials, but, I corrected the information each time. And so, now I know how to do those things. And so my reimbursement is very good. But I have lots of practice. So,
I believe so. How many codes PARO can be used right now? I saw a lot of.
That's a great question. I go to communities where they have assisted living residents and memory care. And so in many of those, I have almost all of the memory care residents. And so I can use PARO for all of those. And so I just take PARO with me. Some, the residents who are cognitively intact are very excited to see PARO. And so they like to visit PARO also. But with the ones who are having or who have cognitive behaviors or behaviors related to their cognitive impairment, it's helpful to have PARO because he's very calming and I can do the medical part of my assessment, listening, doing blood pressure, all those things. And they're more focused on PARO than on what I'm doing. And so that's very helpful. And then we can spend time talking about PARO. So, it gives them an opportunity to verbalize. And sometimes they will talk to the PARO, but they don't want to talk to me. And that's okay too. But I learn a lot from those interactions in terms of my assessment and how they're doing cognitively. So, really with all of the memory care patients that I see that, I take PARO and, because it just simply makes things easier for me as a clinician. So, but it's also very useful in terms of treatment. And then I have the others that I think it's very helpful in assisted is with the ones who've had strokes and need to, I can use that piece of my assessment to order physical therapy, occupational therapy. I see how they're performing. For instance, putting the clothes or the jewelry on the PARO, I can see where their deficits lie. And then I can prescribe therapy that's very specific to that person to help them with their deficits. And I use the PARO to do that. And it's fun for the residents. It's not like it's much more fun than just, can you do this or that? It gives them a chance to have fun with PARO, but I'm assessing how well they're able to snap a necklace or to use Velcro or to tie a shoelace. So it can be very focused in the assessment as well as in prescribing the treatment.
And I have some more questions. So as for the symptoms of the patients, when you prescribe PARO, or when you diagnose the patient with anxiety, pain, depression, agitation, insomnia, and do you find other symptoms? Yeah, for example, patients can be with like dementia, cancer, PTSD, Parkinson's disease, some others. But when they are diagnosed as like anxiety, pain, depression, insomnia, agitation, maybe you prescribe biofeedback therapy with PARO.
Yes, you can. Behavioral therapy. Yeah, the codes I was showing you, those behavioral therapy codes are, yes.
And also, in the case of the people with like schizophrenia and also delirium, can you prescribe PARO?
Yes, yes. Because very often with schizophrenia, you have people who are troubled with delusions or hallucinations, those sorts of things that are driven by anxiety. And so very often PARO can be a great adjunct, especially as they're adjusting to their medications to treat their delusional behaviors with the schizophrenia. And usually, with people who are schizophrenic have trouble with sometimes auditory, visual hallucinations. It can be a wide variety of symptoms as well as grandiosity. But a lot of that's driven by anxiety as well. And so until we can get their medications balanced, we often try to utilize talk therapy or cognitive behavioral therapy. And PARO can be very helpful in the person who's reluctant to talk because of paranoia. So I find that PARO is useful in those mental health settings as well.
So I think today we learned a lot. And of course, you explained a lot to us. And we'll watch the video and summarize them. And I'd like to ask you to take one more time to make a kind of training video for the people who have interest in the prescription and also the biofeedback therapy. Yeah, we'll summarize some points, and then I'll ask you to explain such points in the video. And that will be very helpful for the people who have interest in PARO and also who would like to use PARO in the while getting the reimbursement by Medicare, Medicaid, or like private medical insurance. And also, I have much interested in the case of the children, or like you told us about the autism or developmental problems. So basically, these CPT codes can be used for regardless of the ages.
That's right. That's correct. Yes. Of course, they want to apply to Medicare for children, but Medicaid they would, and also for private insurance. Because Medicare is age 65 and older. Yes.
So for younger people, basically like Medicaid or like private medical insurance.
Medicaid or private. Correct. Because they're doing more mental health services now for children. So that's and then if you have like some of the larger programs for children who are on the spectrum for autism, it can be very helpful. In a group setting to use PARO with behavioral therapies. And they, some of those bill private insurances. Some of them are private pay, but the ones that bill insurance, that would be applicable, or for Medicaid.
So I think we'll announce the existing users of, they use PARO for children. I think they may appreciate or have interest in the CPT codes for reimbursement, I think. Yeah.
I think so too. Some of the other application that I've used it for on a limited basis is with eating disorders. I have adolescents who have eating disorders, and the PARO, while they know it's not real, they're real as an animal. They're very intrigued by the AI and its response to them. They like the response of the social commit robot to them. Some of the interactions were very interesting when I went to visit the eating disorders program at Presbyterian, and I took the PARO, and some were very interested in it just from the fact that they like robots, they like AI. They even some that weren't particularly interested, they would come by and pet it and make comments about it, and they would respond to it. So, I think I haven't explored that further because that's really not the typical population I work with, but I think it may have some application with those individuals as well, because, I think eating disorders are another huge problem that we have now, and we're seeing that at younger and younger ages here. So I think that might be another population we could explore further.
Hi, thank you so much. Very insightful. And in the beginning, the session today, you mentioned about certain syndrome that were obvious, more and more obvious during COVID.
Mm-hmm.
Yes, could you elaborate on it?
Sure. Long COVID.
And then if there will be any codes available in near future?
I think there will be. It's something that we're just kind of seeing in medical practice now coming out of the pandemic. Long COVID, it's something we're also learning about. But what I'm seeing symptom-wise are symptoms that are very similar to those that we see with dementia, the psychological and behavioral symptoms that are associated with dementias. It's very similar. And so the PARO is effective in that. We're seeing also an increase in anxiety. Many of the individuals who had severe COVID have lung disorders now and heart disorders. And so we find that those bring about anxiety for the individual, even if they don't have cognitive impairment. So, I think the PARO is equally helpful in those situations as well. We don't really have medicines yet that are on label for long COVID. I'm finding that N-acetylcysteine and clonidine, help with some of the symptoms that we're seeing, but the PARO is also helpful, and that's really great because many of them are not tolerant of some of the psych medicines that we utilize to treat symptoms. So it's a great non-pharmacological intervention for those that have anxiety or depression, and we really haven't successfully treated them with medication yet.
Thank you.
I have one more question. You talked about the durable medical equipment. And if you know any providers of durable medical equipment, can we make a model, or can we try to make a successful model in Texas with you and such provider? If such providers have a lot of experiences, they know how to make registration, they know how to maintain the product and also relationship, or provide maintenance service to the such individuals. So if we can make a kind of a successful model in one state, I think that can be applied to other states. So, or if you know any good providers, such durable medical equipment, so I'd like to try to collaborate with them.
Okay.
Can you?
Well, I can refer you to some of my students who do that. My practice is fairly unique in the way that it's set up because there are other people who do house calls, but not everybody wants to spend so much time with patients. They would rather do volume than take time with patients. But with older people, you need to spend time with them in order to be successful in treating them. I have probably 15 to 20 now in my practice who are over 100 years old, and they've been my patients for many years, and many of them are doing quite well, but I think it's because we're so attentive to them. And I think the other thing I would say is that many people like volume, like lots and lots of visits over longer visits, although the money is about the same, really. Because if you're not going to spend much time, then you have to bill less, right? So, yes, but I have students who would be perhaps interested. I think one of them, Christian Garrett, I think you may have met, Dr. Shibata. She would be someone who would be interested. And there may be some others of my students that would be interested in doing something like that in their practices.
It would be nice to do it as a research. So if they can write a paper, that would be a very good benefit for them too.
Yes, well, I will definitely ask and see I know Christian is going to be coming back to school, so she would probably be someone for sure who would be good, and she's well versed in PARO. She did her doctoral studies with PARO.
Please ask her to make a paper on her based on her dissertation.
I know. Yeah. Yes, I mean, I think we both have to write her. She's gotten busy again. So.
The results are very interesting. Yeah. Now it's almost done. I mean, almost 2 p.m.
Yes.
So, are there any final questions? So we may have more questions later. So we'll send some email to ask.
And I'm going to send the PowerPoint to you so you can look at all the links yourself, and that way you can look at the information, see if you have questions.
We'll run from the links, and then after that we may have some questions. So we are very looking forward to receiving your PowerPoint.
Okay, very good. It was very nice seeing and meeting you guys, and seeing you, Tom, and Dr. Shibata. So
I just wanted to take a second to thank you. You've been quite helpful and quite accessible while I've been working with PARO, and I appreciate that. And I expect you to continue doing that.
Get it? You're getting right in front of it here.
But you've got a good group of people to work with, so I think that they can make even better use of your input and your teaching to move things forward. So,
absolutely.
thank you again.
Okay. Thank you.
Thank you so much.
Thank you so much
Bye.
for your